Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Phytochemical compounds are a very intriguing area of research when it comes to nutritional medicine as well as mainstream medicine. And one particular food-based nutrient that is highly regarded as having so many different medicinal purposes in the human body is bromelain. And bromelain is one of my favorites to kind of keep up to date with the research because of the fact that it's been around for so long and it is so well regarded in the scientific community with all of its different properties in terms of the mechanism of action of how it is that bromelain is actually working in the body. So I want to talk about that in some detail today and give you just kind of a little background about what in the world bromelain actually is. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk about bromelain and what bromelain actually is, where it's coming from. And we know that bromelain is this complex mixture of different proteases, and proteases or proteolytic enzymes aid in the breakdown of proteins in the body. And this is beneficial. This is why we come naturally equipped with proteases. So when we're digesting food, for example, they aid in that initial breakdown. So we know that bromelain is this complex mixture of all of these different proteases, and it is extracted from the stem of the pineapple, which is why for many people when they actually eat pineapple, they say, when I eat pineapple, I feel like my digestive system is a little bit more responsive. Now, keep in mind, you are getting bromelain from the actual fruit itself, but the majority of that very powerful constituent of those mixed blend proteases are coming from the stem itself. So when we look back in history, we can look back to the 16th and 17th centuries, and we know that pineapple plants were very commonly used crop throughout the world. And what they started to realize was all of these potential therapeutic properties of the pineapple. So you think about the way in which crops were utilized way back when. And they tried to eliminate as much waste as possible. So it's like you try to analyze, what does this plant actually do? So we know it has this fruit that it produces, but are there any other ways that we can utilize the rest of that pineapple? And this is where a lot of the found interest in bromelain coming from that pineapple started to kind of come to the forefront. And it's really quite interesting when we think about proteolytic enzymes and how incredibly important they are when it comes to so many different functions in the human body. So when we think about bromelain belonging to this group of digestive enzymes, for example, then we can say, okay, well, obviously it would be good for the GI tract. But we also recognize that bromelain has many other different compounds that it actually helps to potentiate these powerful health benefits. So it has things like phosphatase, it has glucosidase, it has peroxidase, cellulase, all of these different proteases. And what we know is that the body can absorb significant amount of bromelain, which is very important because when we're taking bromelain as a supplement, there are different reasons as to why you would be taking it, and then how you would take it makes a big difference. So we know when it comes to the intestinal absorption of bromelain, they actually did a study many years ago, over 20 years ago, back in 1997. And this was published in the American Journal of Physiology, where they were actually looking at the intestinal absorption of undegraded protein, and they were looking at the presence of bromelain and what that would actually do. And they found that when they gave people bromelain, this actually helped in terms of a significant intestinal transport of those undegraded proteins, which is really key. So it was showing that proteolytic property to that. But we also know that when we are utilizing bromelain, because it's targeting all these different pathways, that it's actually very beneficial for targeting inflammation. And we know one thing about inflammation is that chronic low-grade inflammation is that driving force to each and every single chronic disease out there. So when we are thinking about something from nature that can aid in the digestion, so it's very beneficial for our GI tract, but something that can actually also target inflammation. This is why bromelain is kind of touted as being this, in a sense, kind of a superfood in its own right. So I want to talk about a study that was published in the Cell Immunology Journal, where they were looking at its anti-inflammatory properties. And what better area of research to look at this than in airway inflammation disorders. So at the University of Connecticut, their School of Medicine, they wanted to see if giving people who have allergic airway diseases, so we think about seasonal allergies, we think about asthma, bronchitis, any of those respiratory inflammatory conditions. And they wanted to see, would the bromelain itself, this very powerful constituent derived from that pineapple that had been reported of having these anti-inflammatory as well as immunomodulatory activities, meaning it's helping to support the way that the immune system is responding. Would this help in the setting of allergic airway disease? And what they found at UConn was indeed that bromelain actually attenuated the development of the allergic airway disease while altering the CD4, CD8, and the T lymphocytes. So that's that immunomodulatory component. At the same time, it was targeting and easing inflammation, which I think is really quite profound when you think about, wow, this is something that's coming from the stem of a fruit that we, for most people, commonly eat. Now, let's go and look at how they have then kind of hyper researched that anti-inflammatory component. So they set up this really cool double-blind randomized study where they were looking at diclofenac, which is a very powerful prescribed NSAID or non-steroidal anti-inflammatory drug, which comes with multiple different side effects. So it's generally prescribed and used with extreme caution. And this was published in the Journal of Clinical Rheumatology. They wanted to see if they gave bromelain to people who had osteoarthritis of the knee, if they would still yield that benefit, the pain reducing as well as lessening the inflammation within the knee. And if they could do this without having those harmful side effects that are associated with diclofenac. And that's exactly what they were able to find in this double-blinded trial. They found that when they gave these folks who had osteoarthritis of the knee bromelain, this provided a very safe alternative to the NSAID that they were currently using, which was that diclofenac. So this is one of those ways in which a lot of scientists said, well, wow, if we can use this and we're minimizing side effects, but yet we're still yielding that same result, then it would kind of in a way be nonsensical if we're not promoting this. Unfortunately, as we know, in traditional medicine, the nutritional aspect and the medicinal benefits of certain phytocompounds coming from things like foods or plants are oftentimes and commonly overlooked or dismissed. And that's really quite problematic. I mean, we've certainly seen how different areas of traditional medicine have started to incorporate bromelain in, certainly in the setting of plastic surgery. For example, they have found that bromelain both pre-op and post-op has been very effective in reducing the swelling and the bruising, as well as the pain after having plastic surgery. So this is something that we are certainly aware of, but I want to talk a little bit about why it is that bromelain continues to be a really widely regarded food-based nutrient. And in the Journal of Food Science and Nutrition, and this was just last year, they were looking at the potential use of bromelain as a natural oral medicine having anti-carcinogenic activities. What does that mean? That means that they were finding that bromelain could actually target and stop that cell replication process in oral cancer cells, which is really quite phenomenal. So remember, we know a couple of different things. We know first and foremost, it's a proteolytic enzyme, so it's beneficial when we think about digestion. But we also know it has these immunomodulatory properties as well as anti-inflammatory properties. So in this particular research that came out last year, that this is what they were specifically looking at, was that bromelain treatment significantly helped when it came to targeting these cancer cells within the oral cavity. And they said it has this potential as being a very novel and natural anti-carcinogenic medicine. Now, I think that this is an area when we look at the real heavy science, this is where you get into much of that immunomodulatory properties and recognizing how that immune-mediated cytotoxicity against different tumor cells is where bromelain is really having such impact and an effect overall. So in this study, they went ahead and they did this in a laboratory setting where they had these cancer cells. And then when they were exposed to that bromelain, they found a significant downward shift in terms of the, I guess you could say, the metastatic properties of those cancer cells, which I think is really an area that I think will start to take off from here. We know if it can target oral cancers, what other cancers can it potentially target? Now, in the Biomedical Reports Journal, they were talking about all the potential roles of bromelain in its clinical as well as therapeutic applications, and there are numerous. So they go through all of the different studies in which bromelain has shown to have this anti-inflammatory activity. Now, the way that they have recognized the true mechanism of action of how it is that bromelain is working is via along that cyclooxygenase pathway and looking how it is regulating the prostaglandins. And I'm not going to get into the heavy details of which prostaglandin or interleukins, but we do know that bromelain indeed has this ability to reduce all of these harmful agents of systemic inflammation. So when we think about things like TNF-alpha, tumor necrosis factor alpha, we certainly know that bromelain can actually reduce the secretion of TNF-alpha coming at that cellular level. Certainly we know that when it comes to the angiogenesis and the metastasis aspect of cancer cells, this is that area where the research is just really starting to get revving up. But one of the ways that they know that bromelain is working is via that inhibition of that cell surface adhesion, as well as targeting NF-kappa beta activation. So if we can downregulate NF-kappa beta, once again, we're helping to control not only the immune response, but also that inflammatory response. Now, interestingly enough, when it comes to areas of research that oftentimes bromelain gets overlooked is in the setting of antimicrobial activity, which I think is kind of one of those things where oftentimes when people have a GI issue and maybe if there is some unfriendly bacteria, the bromelain is actually not only aiding in the proper digestion of the foods, but it's actually helping in terms of that normalization of the microbiome. So we know that bromelain supplementation certainly can target, different enterotoxins that come from things like E. coli or cholera. And we know that bromelain acts as this kind of anti-adhesion agent. And this is why when we look at different GI issues, and we can even throw candida into this, we certainly recognize that bromelain really can be a very powerful natural way to target this dysbiosis that is created within the intestinal environment. So we've seen the studies when it comes to airway diseases, when it comes to inflammation. Certainly I have been a fan of utilizing it for a couple of different ways. For one is for digestion. So if someone has a heavy protein meal, say for example you have a steak or something along that line, then you would want to take that bromelain along with that food, because it'll help with that processing down of that protein. Now, if we are targeting the inflammation, I always advise taking this on an empty stomach so we can really get that bromelain, those powerful proteases, as well as all those other compounds into the bloodstream more effectively. And in doing that, we are going to be able to better target those avenues for inflammation, as well as giving that heightened ability for the immune system to respond more properly. So when we think about things such as arthritis, if someone maybe sprains their ankle, for example, this is another way in which I like to utilize bromelain, as opposed to using an NSAID. Say if you just have a muscle strain or some type of an injury that is brought on, I generally will say, maybe trade off using your typical NSAID, which comes with the different side effects when it comes to liver and kidney dysfunction, and maybe consider utilizing bromelain instead, because we know they put this head to head with diclofenac, and they see the power of bromelain. So there's a lot of different ways in which we can use this wonderful plant-based nutrient and really gain so much powerful benefit from this. So when it comes to healing properties, I talked about the pre-op and the post-op utilization. Certainly when it comes to sinuses, for people who not only have the airway issues, so the asthmas, but also for people who deal with a lot of sinus congestion, utilizing that bromelain can really target those inflammatory regulators that drives up so much of that inflammation. So a lot of different ways in which you can use bromelain if we're using it to ease inflammation, target discomfort. We definitely want to take that on an empty stomach, so about 30 minutes, an hour before you eat something, or a good 2 hours after you eat something. If we're utilizing it in that setting for digestive support, then we want to take it with our food. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes wherever you listen to your podcasts, and you can also follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.